a workshop aimed to present current research and address challenges faced by parents of children with or at risk of autism. We are brought to you by Annexa's Clinic. Moving on with some workshop reminders. Please mute your microphone unless you're asking a questions, and all questions sent via the chat room will be answered at the end of the session. So throughout the webinar, please feel free to ask any question you want via the chat room, and this will be attended at the end of the session. Furthermore, we welcome your feedback. There would be a link to a feedback form at the end of the session, so feel free to give any valuable comments which you feel you need to convey at the end. So just before we start, we'll wait for around 2-3 minutes for other people to join in, and then we'll move on with the workshop structure. So let's just wait for 2-3 minutes, and yes.
Should we start the webinar? I think we have enough people to start it. Your questions are all welcome throughout the sessions, but we'll be answering it at the end of the session. So Animisha will give the workshop structure. Over to you, Animisha.
So, the workshop consists of 7 components. So we'll begin with introducing to what autism is, the core deficits seen in autism, how it presents itself as symptoms, etc. Then we'll move on to some communication enhancement strategies. We will introduce you to pivotal response treatment, which is basically a very well-promising response treatment to addressing communication challenges faced by autistic children. We'll also introduce you to some behavioral management strategies, which include some general tips and a brief overview of functional communication training, which helps reduce meltdowns. We'll touch upon addressing sleep disturbances in autistic children, how to create a structured routine, and we'll end with going upon some emotional challenges faced by parents. We'll also introduce you to some resources that can be helpful to you for dealing with children with autism. So over to Dr. Varsha Saxena, who will take you through who will introduce herself as herself.
So hi, I'm Dr. Varsha. I'm a pediatrician with 33 years of experience in pediatrics, neonatology, pediatric sleep medicine, and development pediatrics. I have my own clinic, Annexa's Clinic in HSR, Bangalore, and I am also attached with Manipal Hospital and Apollo Clinics at Bangalore. Over to Animisha. She can introduce herself to you.
So hello, everybody. I'm Animisha Saxena, and I'm an enthusiastic student of psychology. What I wish to do is to solidify a career in psychological research. My vision is to unearth the secrets of the human brain, the facets of the quality of existence, and to bring this to light in the form of discussion, reports, and art. So I hope I can accomplish this today by showcasing some research to you on psychology and autism, and I hope this will be helpful to you in taking care of your children. I currently study in the University of Birmingham, Dubai, and I'm also a studentship researcher with Psych Reality Dubai. So over to Dr. Varsha Saxena, who will take you through the core deficits of autism.
So we are all familiar with the word autism, and the core deficit with these children face are the social communication challenges. So these are difficulty with non-verbal cues. So as we know, like when we speak to another person, there are certain non-verbal cues of eye contact, gesture, body language, and we take the cues and then respond to that. Autistic children do not have that capability. So they will be looking at a different place when they're talking to you. So the eye contact will be lacking, and they will not be able to guess what the other person is thinking with the body language. And so they behave very abnormally. So you may feel like the child is abnormal in the behavior. Struggles in reciprocal conversation. So when we talk to another person, they are taking turns, staying on the topic, but these children do not take turns, and they may continue to talk in their own interest continuously without understanding what the other person is thinking about it. Literal understanding of language, they do not understand sarcasm, metaphors. It may be a good sign. They're very simple people. They are straightforward. Whatever you're speaking, they understand that. And if you're using a metaphor, like if you say cats and dogs, and so they may not understand. They may think the literal words of cats and dogs. So they don't understand these words. Restricted, repeated behaviors. So this is a hallmark of autism. They have a lot of repetitive behaviors, and these are stereotype behaviors like rocking, stereotype continuous movements you will be seen in the children, and these are a very seen in most of the autistic children. Inflexible routines. So these children have a very rigid routines, and they do not like to change anything in their routine. A slightest change in their routine will cause distress and anxiety to them. Disturbed if there is a major setback in your family or you have a major setback in your life. But for them, in just a change in schedule, the time schedule when they sleep, or when they have to go out, or when they have to do a certain job, or if the bed is not proper what they want, they get stress and anxiety issues. Intense interest. So they do not have a broad interest, they do not have a broad thinking, they have a particular interest and they keep focusing on that interest. We have to use that also in their benefit, because their interest to something will be they can do very fine in a particular thing. Sensory processing differences. So these are the hyper and hypersensitivity in autistic children, and this is also a hallmark of autistic children. They may have hypo and hypersensitivity, and normally it is both of them, to sound, textures, light, touch. So they have a very sensory issues. Sensory seeking behavior. So this may lead to continuous running around. They can't sit in one place because they have to run around and get the sensory sensation. Sometimes they may be doing chewing movements because of the sensory issues, and these are due to hyposensitivity. So next we will be covering about the communication skills in these children. Many of these children are nonverbal, or they have a limited vocabulary. So how to do the communication enhancement of these children? Animisha will get through this.
Hello, everybody. So I'm going to be introducing you to pivotal response treatment. So why it's called pivotal response treatment is that pivotal means integral or important. So what pivotal response treatment does, it targets 5 pivotal areas. And when these areas are targeted, it shows broad results in other aspects of the child's life. So the first pivotal area is motivation, and this is the most important pivotal area. And I'll be focusing upon this area in today's webinar. I will just run through the rest of the pivotal areas due to time constraints. So motivation is very important because it helps redirect the focus of the child. So if you see autistic children, you might have noticed that they if you find it difficult to focus on a task, or they are hyper vigilant, and what motivation is, it redirects the attention to the task. And if you achieve motivating an autistic child, you can achieve various results in communication, analytical thinking, critical thinking, etc. Initiation, basically self-initiated communication, basically targets allowing children to communicate by themselves on their own, and to initiate this communication, we teach children we reward children on based on if they're initiating their own communication. So this is done to activities, etc. Responsiveness to multiple cues basically means that you're allowing the child to multitask, and this reduces hypersensitivity because the child is not focusing on one object, which is usually seen in children with autism. Self-management is basically teaching children how to self-regulate their emotions, and this includes allowing them to express themselves and to see how they express themselves and manage this self-expression by understanding their own emotions. Empathy and social understanding basically include empathizing with people, and empathy also includes enhancing social understanding cues, verbal cues, etc. Research on how responsive responsive pivotal treatment response treatment has been. So a study by Kegel et al. Found that 90% of children who received early PRT developed functional speech compared to lower rates in traditional ABA, because it has not been replicated in Indian populations due to a variety of other variables. But what I'm going to be doing is, in the next slide, I'm going to show you how Kegel, the researcher, addresses pubertal response treatment and how she goes about it. So pay attention to her temperament, how she interacts with children, and how you can go about doing this treatment in your daily life. So motivation studies, results from motivation studies show that children in PRT show higher engagement and lower disruptive behavior. And initiation research also shows that PRT increases spontaneous language more than discrete trial training. So how to start pivotal response treatment? First, you have to identify, if you're beginning with pivotal response treatment, you have to identify what a child likes, and you have to go about encouraging the child to say that particular word, what the child likes, by giving them a reward at the end of their communication. A video by Kegel on how she achieves results is the following.
Technique.
Today we started with 3 steps for working on communication. The first one was finding something he likes, and something that he likes enough that he's going to try to talk for. Tristan loves the swing, so we use that to provide opportunities for him to say swing. Just push him a little bit and get him involved in the activity, and then stop the swing and say, swing.
Okay. Woo! This is the highlight of his day.
Yeah, so let's stop him, and now try to prompt it.
Swing.
The second step is prompting him to talk, and the third is rewarding him for any attempt or any good word. Swing?
Swing? Just a swing? You have to say the word 10 times before he'll even try to say it or attempt to say it, and he'll be upset, which that's going to be really hard for me as a mother because he's my baby.
I want him not to swing too much without saying it so he doesn't say, oh, I'm sorry. Oh, gosh.
Come here. Let's go in the house.
Let's go play. We have to keep giving him opportunities and keep working at him.
Tristan. Cookie? Cookie? Look. It'd be like you're betraying me, you know?
The important thing is that if he does get upset and is trying other things like crying, that they don't give it to him. I know, this is the hardest part. The first few words are the hardest. He's pretty upset. Here, look at me. You want to do everything to keep your kids happy, but, you know, the only thing is he won't learn to talk that way. He's got to.
Yeah.
We've got to teach him the words to say and that this doesn't work anymore. Because we don't want him to be 21 doing that.
No, definitely not.
Deirdre did a great job. I felt like it was very difficult for her to see him cry. But he has to learn that if he cries, it's not a good way to communicate.
Tickle, tickle, tickles. Tickle, tickle, tickles. Tickle.
It's important that he learns that he's got to try to say the word in order to get the item that he wants.
Tickle. Tickle.
That's the first word I think that he said on command. So it was such an exciting moment.
Tickle. Tickle. I think he's laughing and saying it because he knows what he's gonna get. I started crying. I was like, oh my goodness. My son has it in him. And if he has it in him, I am all for bringing out his potential.
Got a little frustrated at the beginning, but this, you know, now he's gonna get it slowly, you know, slowly but surely.
Deirdre put in a lot of effort, and if she continues to put in this hard work, in no time, Tristan's gonna be speaking.
So as you can see, how she approaches this is by first getting the attention of the child and showing him something that he likes and introducing a word to the child of what that activity or particular object entails. So you can see that motivation is one of the important factors to get the attention of the child and to allow him to speak. So it's how do you create this motivation? I'm going to address this further on. So the first most important thing is direct choice. The child should believe that he chooses the activity himself by allowing him to choose. You can do this by allowing him to choose between 2 or more options of activities. So for example, if it's game time, you can allow him to choose between 2 or more games, or when he's eating, allow him to choose what he wants to eat. So it gives him a sense of agency and makes him feel like that he's involved in his own routine and creating what he wants to do. The next important thing is direct natural reinforcement. So make sure that you're giving natural reinforcers which follow through naturally as the flow of the conversation goes. So one example of direct natural reinforcers can be try making him say the name of the food item or game before giving him the game or food. So when you're like what the video showed, uh, after he says the name of the item or activity, you give it to him, and this is what encourages further speech on moving forward. The direct natural reinforcers can be differentiated from unnatural reinforcers, such as giving treats for positive behaviors, or even punishment is an unnatural reinforcer. So kindly refrain from that. Interpersonal maintenance and acquisition trials basically entails that you should alternate difficult tasks with easy ones, and this keeps the child motivated and engaged. This sufficiently challenges the child while keeping him cognizant of the fact that he's doing good and enjoy the whatever activity he's doing. Task variation is also important. So make sure there's enough diversity in the tasks you give him, which keeps him engaged and alert of the activity. Reinforcing attempts is important, so make sure you encourage the child by reinforcing all attempts. Also, how to go about this is to refrain from selectively reinforcing attempts that exclusively result in maintenance of or better results only. So you should try focusing on reinforcing the effort they make on the task, the hard work they put in, rather than just the results. So what you can see is you'll see varied results when you're working with autistic children. Sometimes they might do good in the task, sometimes they might just fall behind, and you will wonder what you have done wrong. But make sure while you're doing this, if the child is making effort, if the child is trying, you reinforce that, and not only depend on how the child does, because there'll be various factors this can happen. So we'll next move on to behavior management strategies. And just to encourage you in behavior management strategies, so the research in in some of the behavior management strategies that we touched upon include functional communication training, which greatly reduces problem behaviors by 80 to 90% when implemented consistently. What you should remember is that this has to be implemented consistently to work. What we have seen often is that parents don't follow through with FCT or how this is done about, and with therapists focusing on this, and this doesn't and thus we don't get the required results. So I hope you learned something from this webinar today and you can implement this at home, so you can follow through on what your therapist is doing in the therapy sessions. What we've also seen is that FCT also influences speech gains. 60% of nonverbal children develop some spoken language after FCT. And these skills that children learn, such as speech and meltdown reduction, often transfer to new settings such as home, school, etc. So over to Dr. Varsha Saxena, who will give you some general tips on behavior management strategy.
So behavior management strategies are very important for children. And so we'll go through some of the behavior management strategies, and these to create a structured environment. We have to create a very structured environment for the children and use routines which are consistent in their daily schedules. This will help in reducing anxiety. This will help anxiety in children. So as we discussed, the children have a very fixed schedules, and any changes in the daily schedule will cause anxiety. So we have to have a very, very fixed schedule for them, and we should not deviate from them. And this can be helped through visual aids. We can have timetables. So each room where the child is, in the bedroom, or we can use one in the toilet where he has his food, the lunch, dinner, there what he has to follow, then the playtime, and then the bedtime. So all these visual display and pictures, flashcards, charts can help him in this. Use clear and simple communication. As we discussed, they don't understand metaphors and phrases. So we have to be clear and short sentences rather than big sentences and complicated phrases. and combine verbal instruction with gestures. So if you want the child to sit down, you just show him sit down, sit down. So just the child show a flashcard to sit down. If he's flapping his hands and you want him to stop it, and you want him to, so you can say, okay, say clap your hand, and you have to show also. And that will give him the visual clue what he has to do. Be patient with the social skills. So patience is very important for parents to, you have seen the video, how many times they tried to let him speak a word, but finally he spoke what he liked the most. So you have to be patient, and you have to know what he likes, and you have to start from the things he likes and then gradually come to the other words, and he will start picking words. And you have to model appropriate social behavior, and we can do a role play. So there can be a toy set with the father, mother, children, and what you want and what activity, what behavior you don't want the child to do. Just show that other child doing it and tell that this is not the correct behavior and other. So, and when the child is in a good mood, you have to do this so that he understand what he has to follow. And manage sensory activities, sensory sensitivity, sorry. So these children usually have hypo and hypersensitivity, and you have to manage them. Like even a sound sensitivity, so the child should not be in a loud where the noise is there, and it can be very minimalized. Like in a sports field, the whistle of the PT teacher, it's a normal thing, but for this children, that itself may be irritating, causing anxiety, and he may not perform well. Create a calming corner for the child so that he can perform well. Sensory toys can be used. These sensory toys are for hyposensitivity of the child, and this hyposensitivity, the sensory toys help them, or giving him some chews for the hyposensitivity. So he's like chewing. Accommodation is very important. Accommodation means that the autistic child have the right to ask for reasonable accommodation at work and school, and whatever necessary things are required for this child to perform should be provided to him. And he has to write, the parents has the right to tell the classroom teacher or the play setting that he has to be provided this atmosphere. Some of the schools, they ask them to write an exam in a separate corner so that they can perform better. Use positive reinforcement. That is very important. A smallest good behavior has to be rewarded with a praise, a hug, a kiss, or a small reward. Be consistent in your routine, and reinforcing the boundaries. Like if you don't want the child to do something which may be a harmful or dangerous behavior with the child, then you have to say no, and you can show a Foro's card, we should not do that, something like that, so that he knows what the boundaries are, and you have to be consistent in it. He may cry a little more, but you have to limit the boundaries with that. Collaborate with therapists and educators. So educators and therapists play a very pivotal role, and we have to coordinate with the occupational therapists, speech therapists, behavior therapists, and all can work together to achieve the best potential in the child. And communication should be open to the school staff also, so that they know what the child requirements are there and they can help. So Animisha will go through about the functional communication training in children. So over to you, Animisha.
So functional communication training is basically an evidence-based behavioral intervention that teaches individuals, often with autism, developmental delays, or communication disorders, to replace challenging behaviors such as tantrums, aggressions, screaming, with effective communication methods. So what it does is you have to teach a child that, oh, you're throwing a tantrum, you're showing aggression, this is not right, this won't do and you will not respond to such behaviors, and you replace that with effective communication methods by encouraging the child to communicate instead of throwing the tantrums or aggression. So the first step in training, doing functional communication training, is to identify the function of the behavior that the child is doing. This is very important, because when you identify the function of the behavior, which it will allow the child to understand that, oh, you understand what the child means by this tantrum or aggression. And the child will also further note that even though you understand his tantrum or aggression, you are not giving him the required reward. And this will motivate him to change his strategy from aggression, tantrums, to effective communication methods. So So examples of the functional behavior that you can identify is escape/avoidance. So this might include hitting to avoid a task. So and other functions of problem behaviors might include attention seeking. So this can be screaming when he's ignored, or access to tangibles as well. So tangibles basically means any object that the child desires. So this might include grabbing or snatching toys instead of asking. So once you identify the function of the behavior, you have to encourage the replacement behavior. So you have to tell the child, please say the appropriate communication, such as for verbal children, you can say help, say please, say give me, etc. You can also say the name of the child the object wants, or stop. For nonverbal children, you can use signs, gestures such as encouraging pointing or etc. You can also use picture exchange systems, which are apps which basically give you visual aids to help the child with autism to communicate. And AAC devices can also be useful, which include speech generating apps that help the child communicate. So after you're encouraging the replacement behavior, you have to reinforce the new skill, and this can be done by immediately rewarding attempts to communicate. So when the child succeeds in communicating, you give him the requested item that he wants, or the attention that the child needs, or even escaping a task that the child wants to avoid. And please ensure that you ignore all problem behaviors until the child begins to communicate. So the child understands that the tantrum or the problem behavior will not do, and he has to make efforts to communicate. So some examples of functional communication training can be, if you want to replace aggression with words, such as, for example, when a nonverbal child bites when he is prompted to clean up toys. So you must identify that this is an escape demand. So he wants to escape the situation. So allow the child to know that you understand what he wants, and then teach and kindly encourage the child to say break instead, or hand a break card instead. And when he does this, you can give him a short break from cleaning. So that's a little bit rewarding, and he's encouraged in replacing the problem behavior with communication. And the result of this would be that the bite increases and the child uses the card. So another example of FCT, if you want to reduce screaming for attention, includes might include that when a child screams when mom talks on the phone, so you must identify this as the attention-seeking behavior, that the child wants attention. So the FCT solution might include that you can teach to tap the mom's arm instead, so that can signify that the mom's paying a little bit attention to the child, she's catering the child even when she's talking on the phone. So, or you can say something like talk, and you can then give the child a little attention when he says so. So the result of this is that the screaming drops and the tapping increases. So next we will move on with sleep disturbances in autistic children. So over to Dr. Varsha.
So sleep disturbances in children are very common in autistic children. And although the requirements are same as a normal child, so there are certain time which the normal child requires for sleep, like 1 to 2 years, 11 to 14 hours, 3 to 5 years, 10 to 13 hours, 6 to 12 years, 9 to 12 hours, and 13 to 18 years, 8 to 10 hours. But it appears that autistic children requires less sleep, and they may have issues of sleep, which are difficulty in falling asleep, staying asleep, or getting a restful sleep. And several factors contribute to this. The sensory sensitivities of the child, the heightened hypersensitivity, so slightest sound, slightest light, or a touch of or change in the routine, or there can be a different type of cloth you have used, or different pajama set that can interfere in the sleep of the child, and will not be able to understand it. Anxiety and hyperactivity. So these children are prone for anxiety and hyperactivity for smallest issues. And this decreases the sleep whenever we are anxious and having, it disturbs the sleep of the child. Communication difficulties. So these children struggle with their communication and the way to express themselves. So whatever they're feeling, if they're having sleeping difficulty, the decreased sleep efficiency or latency in the sleep, this they'll not be able to communicate to you, and you find the child doesn't sleep and keeps waking up. Rigid routines, as we already discussed, that they have a very rigid pattern, and slightest change, you have changed the room, changed the location, somebody has come to the house, anything will disturb their sleep. Melatonin imbalance. So melatonin is the hormone which helps in the initiation of sleep, and we find that there is irregular melatonin levels of hormone in these children, and melatonin is very promising in helping these children to sleep better. So there are certain proven sleep strategies which can be done, which are tailored for these autistic children. Provide a comfortable sleep setting. So you understand, you'll get to understand over a period of time what are the things he likes. Does he likes a dark room, or he's afraid of darkness? Then there should be a night lamp. There should be silence in the room or in the house itself. So that's very important. Establish a regular bedtime. So it has to be very fixed bedtime and should not be deviating like more than half an hour here and there. It has to be very fixed bedtime, or both on weekdays and weekends. And there has to be visual to-do list on the room so that they know what they have to do. A tool for teaching. So this is very interesting. A bedtime pass can be used. So you make a flashcard of the bedtime pass, you give it to the child, and tell him that you can use him only once in the night. It can be used where the parent can come, give him a hug or drinking water. And so this can be used. And if he doesn't use it, tomorrow he will get a gift. So you will see this is the subconscious mind training of the child, and slowly he will, wanting to have that gift next day, he will start using that bedtime pass. The sleep fairy concept, where we give the child in the night a gift and say the sleep fairy has come and given you a gift because you slept properly throughout the night. Or even if he sleeps initially for maybe a good period, and then we continue to give it every day as he improves in his sleep. And once it is settled down, we skip some periods. He may ask, and then you can say the sleep fairy has to go to different houses to give this gift to every child. And then he will slowly start, and you don't know when their gift will come. So this random thing will help him continue the sleep pattern. Determine which events are calming and which events are stimulating for your child. Encourage calming behaviors during the sleep time, like although there may be like bath time in the night. So this can be stimulating to some child and it may be calming to other child. So if it is stimulating, don't keep it in the night. But if it is calming, then please keep it during the night so that he calms down. Limit screen time before bed. So there should be, we can call it as a screen curfew before the bed. It be 1 hour before the bedtime. No tablets, no phones, no TV. Only a book can be given. So this will prevent the blue light interference with the sleep. Limit caffeine and sugar intake. They are stimulating to the child's brain and should not be given. If he wants to eat the food, it has to be a light snack like a fruit and not anything which is high sugar or caffeine, especially chocolates I'm referring to. What if I have made changes, but my child's sleep has not improved? You can consult a doctor or a sleep specialist, a therapist, because they can help you in this. There are other ways which professionals can help, like cognitive behavior therapy, which is used for little older children, or applied behavior analysis, where we analyze the sleep of the child, the sleep schedule, circadian rhythm, what is the sleep efficiency, and then guide the child to help the sleep better. And drugs, like I told, melatonin shows very promising result, and doctors can prescribe that. So now how to create a structured routine we have been talking about. There are certain tips in this. So this is a sleep schedule made for a child, but it has to be tailor-made for your child. Wake up time, fixed time, visual schedule, morning get up, then what he has to do, he doesn't know. So you have to put it on the room, what he has to do. The hygiene routine can be put. Now he has to go and brush his teeth. And then mid-morning, he has to play, or he has to go to the play school, and that will help boost focus and calm. Outdoor activities you have planned, that has to be planned on a particular time of the day. Lunch has to be quiet time. Then afternoon can be a little quieter time where he can do speech therapy, learning activities, coloring blocks. Everything should be fixed and what he has to do. In the therapy centers, we see when we do the child with the same thing. Just they come and they start doing their work one by one, whatever is told to them, they do it very properly and start learning things. Evening can be playtime. Then again, you have to take care of the sensory activities. If the play or certain exercise or playing is stimulating the time and interfering the bedtime sleep, it has to be a very light playtime so that it doesn't stimulate the child. Bedtime routine, again, it has to be clearly known to the child what he has to do before the bedtime. This usually is like, for a smaller child can be half an hour, sometimes bigger child can have a 1 hour bedtime routine, which he can follow so that he understand that next step, what he has to do. So these are certain pictorial way which you can help the child, like the bedtime routine is a bath, put on the pajamas, snack, brush your teeth, read the story, and tick it. Let the child himself tick it. Make the child do himself. When he owes that response, he performs better. Time to do this is the toilet where you can put what he has to do inside the toilet. So he can be and you don't need to go for him for every time to do the necessary things in the toilet. And these are certain flashcards which can be used: wake up time, brushing the teeth, lunch, anything, and whatever you want. Or if he is showing meltdown at certain points, what you have just now, Animisha, discussed, like we have to tell him, like instead of the mother is working on a laptop and he's pulling the laptop, instead of if he's verbal, he can say break, break. So he understand, okay, now I have to give the break. If he's non-verbal, he can just touch the mother 5 times. You touch, then she can take a break. So he has, instead of doing excessive anxiety and meltdowns, you can tell the child, give him the flashcards and tell him you have to tell like that. That way also flashcards can be used. And so parents undergo a lot of emotional stress. I can understand. You've seen in the video also 100 times that parents will be in overwhelmed tears. So how do parents can help themselves to handle these children? Animisha will take through that.
So I'll be taking you through the navigating emotional challenges faced by parents. So what research has shown is that children with parents with children with autism often experience higher stress levels compared to those with neurotypical children. So parents of autistic children have actually reported stress levels comparable to combat veterans. And this can be an alarming finding, and it is very important that you take the necessary measures to support yourself in this while you're caring for your children. So research has also shown that there's an increased risk of anxiety and depression among parents with autistic children. And research has found that it has found a particular resilience factors that can help reduce the negative mental health impact of taking care of autistic children or higher stress levels. And what they have found is that the resilient factors are social support and self-care. So social support is very important. For example, you should depend on others, so you can express yourselves, you can express your concerns, you can tell them what is stressing you out and how, and what about your daily routine, or what apprehensions you have regarding how your child will grow up. And just expressing these selves and discussing them with your peers or your partner can actually reduce negative outcomes greatly. And you should also make sure that you have an optimum amount of self-care, that you're taking care of yourself, you're organized, you're having rest days. So you can really, it reduces your it reduces your stress, and you can really look into your daily routine with a clear head. So just an example that I would like to point and like help you with is that you may face criticism or helpful suggestions that just miss the mark from other parents, that other people will come up to you and be like and give you suggestions or help that's not needed. So in these moments, I hope you can remember that these moments don't define you or your child's worth, and a brief prepared response can ease tensions without engaging in debate. So example replies to this could be: every child grows at their own pace, but focusing on what works for ours. And I appreciate your concern, but we're happy with our approach. And just a final reminder that please engage in social support. There are social support groups available online, which can be a lifeline. So there can be local in-person groups that you can be helpful to, or online ones as well, as I pointed out, such as Facebook groups that have 24-hour access to advice, encouragement, and shared experiences. So while you're navigating the emotional challenges that you're facing, it's important that you remind yourself the unique strengths of autism. So children with autism often have various cognitive and creative strengths. For example, they have hyper focus and deep learning. When they're invested in one activity, they are very invested. So they have intense passion for interest, which leads to expertise, such as coding or art, or even some niche areas such as mastering dinosaurs. They're very detail oriented. They're very good at spotting patterns, errors, or details others might just miss. So this can be helpful in math, science, or music. They have creative problem-solving abilities, and they often come up with novel approaches to challenges or problems, which can be seen as out-of-the-box thinkings by other neurotypical children or parents. They have social emotional gifts, such as radical honesty. They have authentic communication and no hidden agendas. They are to the point, and they won't try to manipulate you or any other manipulation technique. They have hyper empathy. They deeply feel others' emotions. So I want you to remember that even though it might feel that your child is lacking in communications or doesn't really understand your intentions, I hope you can remember that they can feel or more or equal to what you're feeling, and they can relate to your emotions in a deep way. They also display loyalty and fairness. So they have a strong sense of justice and commitment to loved ones. So you can enjoy that, the justice and commitment that they bring to the table. They also have sensory and perceptual strength. They have enhanced perceptions. They have heightened senses such as hearing, visual, memory, or tactile sensitivity. They have a unique joy and simplicity, and finding wonder in small details such as a spinning fan or textures and rhythms. And this can be surprising or even uplifting at times. So just a small video to just it's a little mood lifter. So this is a little TikTok I would like to show you.
This is my little brother Corbin. He's 573 weeks old.
Dang, I'm old.
You guys would say 11 years.
Oh, never mind.
He suffers from autism.
I don't suffer. I just have it.
So I hope you remember that it's important to make note that the child doesn't think that he is different or suffering in a way, and you can bring the to light in a positive manner that I have shown over here. Over to Dr. Varsha Saxena, who will just close the seminar for you with some closing points.
So dealing with autism is no magic method. Change behavior should be in a structured way, and it'll take time. Your patience and perseverance is very important. 10 golden rules, which can be very helpful to get the best out of autistic children. Token boards, very important. You can use a board. You can put stickers, and maybe like each activity which he does, which is good, or slightest effort he shows, not the result. And you can just put one sticker, and a smiley sticker. And once there are 10 stickers, he gets a reward. So this can be used as a tool. Be consistent. Consistency is crucial. Maintaining bedtime, wake time. I understand somebody has to be totally devoted to continue with this so that the child needs are taken care. And but it is very important because they get anxious with any change. Behavior momentum, sometimes we use that. You can see in the therapy centers. In the video also, we have seen that she uses it. So behavior momentum is like if you want to make the child hold a pen and write something and he doesn't want to, he wants to just play or something like that. So you can use it, touch your face, okay, touch your balls, touch your bat, something, anything which he likes it. And then finally, okay, now the pen. So he just hold it. In that momentum, he may do the things which you want him to do. Differential reinforcement of incompatible behavior, like if you want stop flapping of hands, then you have to give another thing, which give something in his hand which he likes it, and he may stop it. Or he likes to, like in that video, there's a tickle, so you can use tickle, and he should know, okay, we'll do tickle and just do some other behavior which he can't do it. Or removing one hand, then instead of the right hand, you give it into the left hand, he'll stop moving that hand. Gesture and visual cues are very important. You have to tell the child what he has to do, and with the flashcards, with your gestures, you have to show him what you expect him to do. Wait for the response. There's no power struggle. You keep on telling him one response and he's not responding, it will never work it out. Just two commands, gesture, visual clues. He doesn't, then wait. He is not ready. Maybe something else we can do it. And redirection. And it is basically gently guiding the child from an inappropriate, harmful, or unproductive behavior towards a more appropriate and desired behavior without a punishment and confrontation. So if he is in other behavior, try to distract him and do another thing which he likes, and we can come back to this behavior after some time, or use some other way to make him do that behavior. Timers, stopwatch, smartphone, or a sand timer. Sometimes they're running around and they can't sit. There is a very poor sitting tolerance, and you know he can't sit more than 2 minutes. Then we can have a timer at 2 minutes. What he can do so that he is okay. And then break time. You have to show the flashcard, break time. He takes a break, come back, and break time also has to be timed. And he comes back. Then after a few days, you change the 2 minutes to 3 minutes without his knowledge, and he will see that sitting tolerance will start increasing. Positive reinforcement, it goes a long way. Each and every effort of the child has to be rewarded, and which gives him the boost and confidence. Reverse psychology, which I have seen in many children, especially for toilet training, I have used many times. Children, they don't want to sit in the potty seat, and they don't want to, they may stand and do the toilet, and this will all cause constipation issues. So one of the parent can become with the child and say, no, we'll not allow her. We will make him do. So tell him the opposite, and he may do in a reverse way. Accommodation is very important. That school, wherever the child is going, or a play center, has to be informed about his sensitivities, and those has to be taken care if you want your child to perform best. So adults have to change, align with the pace and sensitivity of the child. And as we know, autistic children are not having any IQ issues. They are having a very great IQ, and they can perform well in their lives.
So we would like to thank you all for listening. So I do not see any questions in the chat.
No, there are.
Okay. Okay, so let me address some questions that you have.
So the question is, my daughter has a tongue tie and she's 4-year-old now, but she can't speak clearly. For example, lorry means she will say lolly. What to do, ma'am? Tongue tie, it's not 100% related to the speech of the child, but it can be a factor. Mostly tongue tie shows as feeding difficulties during the childhood, but she's 4 years now. You'll have to refer to an ENT specialist. A general idea I can give, like if the tongue doesn't come and touch the lip of the child, like this. So if the tongue is not touching the lip of the child, she may have a tongue tie. So if she's able to touch the thing, the tongue tie may not be a factor. The child is not speaking in some other words. You may have to do a hearing assessment of the child, because hearing is not just general hearing. There are high pitch sounds, there are low pitch sounds. Sometimes the children are not hearing certain particular sounds. So he's not speaking lorry. She's not able to hear the word R, which is a high pitch sound. And you will have to check for the hearing assessment. And the tongue tie, yeah, it can be one factor, but you please check with a doctor. What is the difference in autism and ADHD? Now, autism is both are neurodevelopmental issues in the child, but the child do not have any mental retardation. Both are having normal mental IQ. But autism hallmarks are hypersensitivity, repetitive movements, and while ADHD usually have hyperactivity. Some of them are overlapping also, like hyperactivity, the child will not sleep. But ADHD will have impulsivity, hyperactivity and impulsive child. And the ADHD child, you can well recognize. If my clinic, when ADHD comes, he will throw each and everything on the child. He may throw the toy on us also. So this is hyperactivity. But nowadays there is sometimes both the things are combined together, and we call it as AUDHD. So both the things are there in the child. Medicine for both the treatment is there for ADHD and autism differs. So you will have to meet a neurologist or the neurodevelopment pediatrician who can find you what is ADHD or the child is autistic. What are the early signs of autism?
So one of the early signs of autism on the most prevalent is eye contact. So if the child, it's very natural for the child to make eye contact. It happens naturally in children, neurotypical children. So if the child is struggling to make eye contact, he might have autism. Another issue can also be that a child might also fail to imitate the parent. So when you are smiling and the child is not responding in a similar manner, it's not smiling back. So that can be one of the early signs of autism. And speech delays can also imply autism, though not always, they do not always imply autism, but it can be a great sign of autism is that this child has delayed speech. And so I hope that answers your question. And
so I would just like to add some
Yeah.
very salient features of autism, which the red flag sign, you can see it at home. If the child is not making eye contact, as she told, and if the 9-month child doesn't respond to his name or sound, a 12-month child doesn't say a single word, a 15-month child is not responding, not pointing, an 18-month child is not producing proper sentences and not sentences, sorry, proper words. And these are all the red flag signs, which you can monitor at home. And then you can meet the child specialist and show these things, like these are the things which you can monitor at home. Yeah. So the next question.
How to reduce toe walking, what are the home remedies? So I think I think you should do a muscle therapy or movement therapy, which can help. You should allow the child, encourage the child to you should encourage the child to just slowly to walk on, to reduce toe walking, to walk normally. This might be difficult, though it's not totally like it's not very harmful to the child further on, but it is best to remedy that as soon as possible. So I think if you're struggling to do so at home, I would recommend going to a developmental specialist and they will help you out with that. But slowly encouraging the child, rewarding good at times, motivating the child, this just in a fun way, let me do a fun activity for you. Try to walk straight in a line without using your toes. You will get playtime afterwards. So in such a sense, you can help, you can reduce toe walking. Can you suggest some helpful exercises that can be followed at home for improving speech?
So speech, as we have already discussed the FCT for improving the speech of the child, but we can also use like smaller sentences, very 2-word sentences. Single language should be used, like do not use multiple languages that may interfere with the speech. And I would suggest very limited screen time, because screen time does interfere with the speech of the child. You have to talk to the child so that he reciprocates and use the words, the activities he likes to do. So those things, the speech can be utilized on those things. This will all help. And sometimes it may be because of the sitting tolerance. So if you improve the sitting, first the person has to listen to speak. So the sitting tolerance, there can be certain activities which improve the sitting tolerance. Sometimes we say just coloring. We give a face and tell the child to put a bindi on that face. So that increases the concentration, sitting tolerance, and that will help in grasp speech better. So these things you can do at home, and you can go to a speech therapy center, because we see wonderful results with the speech therapy. Within 3 to 6 months of these therapies, they get a lot of speech improvement in the child.
Okay, so Nivita Arjun wanted to add that toe walking is actually that she can't touch her upper lip. So I'm sorry that I misinterpreted that. Touching upper lip, you should refer to the developmental specialist. And if you want to reduce that, I think, again, same motivating activities, allowing the child to understand that you want to achieve this outcome, and she will be rewarded for that particular outcome. So you can try addressing that through that.
So there are certain myofascial exercises also can be done for the tongue. And nowadays there is in Bangalore, we have in other places where the myofascial exercises are there. They teach the tongue exercises, and a lot of benefits we are seeing with that, where the tongue activity can be improved, and you can meet one of them that will help. Plus, if it is really not touching the upper lip, the ENT can also be such a simple tongue tie operation, but it has to be done as soon as possible, because speech development is very important in this years. He's already 4 years, and if his tongue restrictor is the major factor, it has to be treated. But tongue exercises or myofascial exercises can be improved. From Megha Srijat, my daughter is 4 years and she is doing therapies for almost 1.5 years. Still, we don't find any improvement in speech. Can you suggest any child development schools in Whitefield? I think you can, have you visited ComDeal, which is, they have many centers, and they have a very planned program for autistic children. They have a 6 months and 1 year program, and you can visit one of the quarantine centers, and their main center is in, I think, HRBR layout, but they do have centers in other places. We will separately send you the list of the centers, and you can meet one of the ComDeal coordinator, or we can send you the details to connect with them.
So these are some further resources that if you want to screenshot the screen, you can do so right now. There are some national organizations or helplines that you can use, or there's some apps as well. So if you want to create social stories to teach routines or games for speech and social skills, you can screenshot this. And next we'll move on to the feedback. Yeah, so you can just scan this QR code and it'll link you to a Google form, just so that we can improve ourselves. We can understand what worked and what did not work. So feel free to add feedback to the feedback form. And I hope you enjoyed this video. So we'll be here for 5 minutes. And if you have any more questions, feel free to add.
So this webinar will be there uploaded on YouTube, and any of your friends or your children are suffering with certain issues which may be linked to autism or any development issue, you can share the video and connect with us. From Annexus Clinic, our website is www.annexusclinic.com, and this you can tell for any further assistance in this. Thank you for attending the session, and thank you for attending the session, and thank you very much for taking your time out on a Sunday morning. And we will be very glad if you can send your feedback. If you want any other topic to be discussed, not only related to neurodevelopment, for the child issues, pediatrician. I'm a pediatrician. I mostly will be very happy to attend your queries. We do have online consultation facility also, and you can get all the details on www.annexusclinic.com. Thank you very much.